Thanks for joining us for this symposium. I'm Bill Rapisi, President and CEO of the Lymphatic Education Research Network. LE&RN's mission is to fight lymphatic diseases through education, research, and advocacy. In order to win a fight, you first have to join it. So we ask, please become a supporting member of LE&RN at lymphaticnetwork.org. And we hope you enjoy today's symposium.
Good morning, everyone, or good afternoon, or good evening, wherever you are listening in the world. For me and Margareta, who are here today to present, it's 4 o'clock in the afternoon. So we are here to present this better research and healthcare with patients and next of kin collaboration. And then we decided that we should stop sharing for a little while and just introduce ourselves. So my name is Mikaela Friedman. I'm working as an external relations officer at Genomic Medicine Sweden. In Sweden, I'm also employed by Karolinska Institutet. And Margareta, you will introduce yourself.
Yes, my name is Margareta Haag, and I am the chairperson of the Swedish Network Against Cancer, which is a cancer umbrella organization for cancer-profiled patient organizations. I was the president of the Swedish Association of Chronic Oedema from 2010 until 2024, and now I'm a senior advisor there as well.
So we're gonna have some 20-25 minutes or so with the presentation. We will take turns a little bit, and then we will open up for your questions. And we've been told that you're supposed to write your questions in the Q&A, and then we will answer them the best we can in the end after the presentation. Yes, I think that's it. So let's go back to the presentation, and we'll just show these slides for a short minute or so, and then we go over to our presentation. So we're here to present a report and how we've been working to produce this report and what we've done in the past 1.5 years after this report was published. And this is a true collaboration between patient representatives and profession working in healthcare and research, where Margareta and I were two of the persons in this group. So I just wanted to say a few words that I missed. So just what Genomic Medicine Sweden is. So that is a national initiative in Sweden that is implementing personalized precision medicine into Swedish healthcare. So if that wasn't really clear. Okay, so let's move on. So as I said, we've been a group of I think 7-8 people. It's depended a little bit over time that started these discussions, I think 4 years ago or so. How can we work together? Patient representatives, people working in healthcare and in research. And we started with the idea that perhaps we should form some sort of patient council, or we weren't really clear. And then we decided after many lengthy discussions that we should take a step back, look what has been published in literature, and really try and look into the models of collaboration and co-creation and start from there. And we formulated this vision, a society more sustainable in the long term, where all members are able to contribute and to achieve the best possible health and well-being over time. So the report that I was mentioning, that you could see the cover on the other slide, and we will come back to, if you're interested in reading the report, we will come back in the end where you can find it and download it. But the report is based on an extensive review of scientific literature, where we've been going through around 8,000 scientific articles. And on top of that, we also looked into grey literature, like popular science literature or other reports. We've been doing a series of interviews with patient and next of kin representatives that we highlighted as quotes, for example, in the report. And we've also looked into our own organizations. How have we over time been working in a collaborative way, co-creative between research, healthcare, and patients? And as I said, this has been going on over several years of dialogues focusing on the needs and challenges. And many of our patients and next of kin representatives, they have been part of many different collaborations and patient councils in different types of settings, both with the authorities and with the Swedish government and so on. So there were lots of experience already on how this can work, both good examples and bad examples. Taking a step back, so the question was then, why should we collaborate in the first place? Is this really necessary? Does it bring any value? And looking at from the literature review, it shows several positive results and effects of collaboration. So advantages in research, for example, could be that you get more relevant study objectives, more relevant study designs, better outcome measures, and more funding opportunity for your research. And looking at healthcare advantages there for collaboration could be increased trust, increased efficiency, increased quality and patient safety, and also improved health economics. And now I will hand over to Margareta, and she will walk you through the 6 recommendations that came out of this literature review and that we have in the report. Please, Margareta.
Thank you, Mikaela. The first recommendation that we actually got through these 8,000 articles in English and in Swedish, I think it was that when we looked upon all the recommendations and we looked upon everything that has been published, we found that there are some very important issues that actually can make us work much better together for better research and for better healthcare. So number 1 of the recommendation was that we really see that you should have clear aims, goals, and evaluation criteria that are formulated by all parties together. Because when you really want to include partners with different perspectives, you will also have different aims and goals. And it's very important to discuss them openly. Clinicians and researchers inform patient advocates all the time to learn health literacy. But we noted that clinicians and researchers need to learn patient literacy. Then you may reach understanding of the different perspectives, and the working climate will be much more effective, productive, and much nicer also if you understand each other. Maybe you will have to compromise, and then you have to be extra clear so that you all can agree upon common goals. And finally, it is very important to also think about evaluation of your progress. Next slide, Mikaela. So number 2 of the recommendations is that you have to talk about and confront power imbalances. There will always be partners who have more power than others. And as a patient representative, you feel it many times when you walk into a table, into a working group with politicians or with researchers or with clinicians, that you are not at the same level as the other around the table. We feel that we actually have to try to become partners so we can reach this better quality of research and healthcare. So the more power you have, the more you have to address it. Every partner needs to know what they can achieve in this collaboration and what they cannot achieve. And this is necessary to be able to plan your resources and your engagement and to avoid disappointment and mistrust. Next, please. The third recommendation is that you have to communicate very clearly in order to build trust and confidence because of the imbalances in power, resources, and different goals. All partners will not be equally involved in all processes. And in our group, we were actually started to see how we could work out this report and how we could process our common work. It actually took us almost half a year to sit down and have meetings, maybe once every 3 weeks, and to interview each other about what we had done, our experience, our knowledge, our ways of working, and what we did not know about each other. And that was a lot that we didn't know about each other. But slowly we actually built the trust and the power between each other also. So you have to communicate openly and clearly in order to avoid misunderstanding. And this open dialogue and inclusion of different perspectives will help you finding new solutions. And we really found that when we worked together for those couple of years. And next, Mikaela. Recommendation number 4 is that you really should aim for remuneration and representativity. The more perspectives that can be included, the better. But be aware that work from patient and next of kin is often voluntary. And sometimes the patients and next of kin cannot join you because of being weak or ill and so forth. And that they do not have the financial resources to work with other people. In order to really be able to include multiple perspectives, you have to find solutions for reasonable remuneration for participants. And to reach representativity is really difficult. You will never reach out to all relevant groups. But a very good start is to perform a mapping of all relevant partners and then taking an informed decision of which and how many you can involve. Next. Resources in non-profit organizations are often vulnerable. Include more partners than you expect that you need. Patient representatives in cancer profile organizations are often weak, and many need to withdraw from activities due to lapses in cancer or becoming more vulnerable. And as a matter of fact, in my board, usually 1 to 3 members of my board out of 9 die every year. So it is sometimes very, very difficult to continue working or to delegate to somebody else. You need to have more representatives than you actually think that you need. And the recommendation number 5 is to build long-term structures for collaboration. It is very important because you can reduce both costs and time invested if you plan long-term. Also, you will grow trust and confidence within the collaboration group, but also in your own organization by showing that collaboration is a priority and that you have structures in place for it. I have been involved in forming a patient board in research for a national platform study. And it took us a long time to make the researchers understand the patient perspectives and vice versa. So in the end, when we actually could sit around the table and work together, the whole group understood the necessity of collaboration, and that it is a real priority, and we need to have the structures in place for it. And next one. Recommendation number 6 is that you should share your experiences, good ones and bad ones. And we were very open in our group to really talk about the good experience we could see and the bad experiences. You should spread the word in order to contribute to the cultural change that is needed to reach true collaboration throughout society. And you will also save resources by learning from each other and from each other's mistakes. finally, you will increase the public understanding of and the interest in collaboration. So, Mikaela, that's one. Our 6 recommendations, you will find them also in an easy overview in our report that you can download, or you can see it on our homepage, samka.se. Samka.se is an old Swedish word meaning collaboration. I will also repeat the recommendations here very shortly. Clear aims and goals, as well as evaluation criteria that you develop with all partners together. The power imbalances that always are there have to be addressed. The clear and open communication that you have to focus on. The remuneration and representativity that you should aim for. And the long-term structures that will be of value both for you and your organization and for your common work. And the sharing of your experiences, the good and bad ones, so that others can learn from them. And next one, please. So here you see the checklist of recommendations again, and we could actually see, and we have now experienced, that the recommendations and the report has actually done it easier and facilitating the process of co-creation and reaching an understanding of each other's perspectives. And as well, it's learning to co-create with respect, trust, and understanding each other. And this all is leading to better, more effective research and healthcare. So, Mikaela, can you start with
Yes,
hello?
thank you. Thank you, Margareta, for a great overview over the recommendations that we've been working with. So, as I said in the beginning, we published this report 1.5, close to 2 years ago, I think now. So what has happened since then? We decided that we weren't really finished. We had the report, but it needed to be disseminated and worked with and acknowledged. So we applied for some project funding from the Innovation Agency in Sweden and got some funding for 1.5 years. So in the last 1 year or so, we've been working quite a lot with dialogues. We organized meetings with different stakeholders discussing these different types of issues that are raised in the reports. So we've had, for example, dialogues with research funders, with primary healthcare, actors in preventive health, researchers in person-centered care, and together with patient representatives. And we've also had several open meetings where anyone could just join. So there's been quite a lot of patient and patient representatives meeting together with researchers and healthcare profession. And we've recorded these ones so that we can look at them afterwards as well, and trying then to follow up in dialogues with these stakeholders also a year after the initial meetings, to learn more how have they been working. And some of them already had a clear way of working with this. For example, when we had the meeting with research funders, we had a meeting with the Swedish Cancer Foundation, and they already had a quite started on the road on a process how to involve patients and patient representatives in their work of evaluating research applications. So it was interesting to learn from their work as well, and we have a very fruitful discussion, whereas other research funders hadn't at all thought about these issues. So it was an eye-opener for them. And Margareta, she's been leading the work on going on a world tour to present our work. So you will tell us a little bit about the international meetings where you've been.
Yes, and I've been involved also with the Swedish government and the Swedish parliament to have workshops and dialogues and presentations with them, and also with Swedish authorities. And it has been really interesting to hear and to listen to the discussions after the presentation and all the questions that many have, that how can you actually involve patients from the very start in research, for example. And we find that it has been difficult sometimes, but it has been acknowledged now in Sweden, I think, that you need to have patient representatives aboard whatever you do. I've been a member of the Swedish government patient group, and they have really invested in this, so that they want patient advocates to be in every organization close to the government. And as Mikaela said, I've been sent out to the international arena to talk about and to present this report we had. And the first one I went to is European Society of Medical Oncology. They have annual meetings in different parts of Europe. So I presented this both in Madrid in 2023 and in Barcelona in 2024. And it led to a lot of questions about how can we do? Give us the reports. We have produced, I think, 400 reports in English, and they're almost out of stock now. And a lot of people are asking about it on mail and in this meeting also, how we can work together. This became an issue, so that the Health Ministry of Kazakhstan phoned us and wanted us to have a meeting with them. And that was interesting because it was not only the Health Ministry, it was for researchers in Kazakhstan and for hospital caregivers also. And I've been involved in the European Commission, joint actions, network experts, at which I have presented the report, and we have had roundtable discussions about how to involve patient advocates more profoundly in all European work in healthcare and in research. And this has led to more work with Europe and with the comprehensive cancer centers in Europe also, at which table I sit and try to work with them so that they understand how we can work together for better research and for better healthcare. We are members of Cancer Patients Europe, and we've had workshops with them about this report and how to involve patient advocates and patient representatives in research. And in Europe, they really see the importance of it. So it's very easy to go along there with some stakeholders. I was in Washington in March last year with the Sweden-US Cancer Summit, and I presented the report there at the meeting with, it was organized by the Swedish government and the Swedish Embassy and the US Biden committee also. And it was very interesting to see and learn about how different we are in patient advocacy in Sweden and in the United States. And oh gosh, sorry. And in this group, we are all doing this for increased awareness and understanding of the value of patient method in co-creation. And this group, SAMCA group, we are having a final conference in April, at which the Swedish Minister of Healthcare will come, and we will finalize our work and see how we can progress in the future with this. So, Mikaela, it's up to you.
Yes. Thank you, Margareta. So that was our slides and the presentation that we had. The QR code here will lead you to this samca.se webpage where you can download the report in English and also the checklist and the recommendations if you would like to. And we also want to acknowledge, of course, all of the other people that have been working together with us. So it's Eskil Digcell, that is from the Swedish Brain Tumor Association. Your name is there again, Margareta. I'm hoping that we haven't missed anyone else. Stephanie Juran from Rare Diseases Sweden, Sara Riggare, that is from Swedish Lead Patient Network, and Anna Claiborne from Uppsala University. And we actually have a few more people working with us now since this next phase of this project started. I will stop sharing the slides now, and we have a couple of questions in the Q&A, and I think I will read the question and I will direct it to you, Margareta, to start off with at least. It's Kati from the Finnish Lymph Association, and she writes that we have tried to get exactly this kind of cooperation. However, the problem has been that no one in high authority listens. So the grassroots question then, any tips on how to get them to listen to our important issues and our concern? And I think since you've been working quite a lot on this high level, what are your tips?
Well, first of all, Katie, there is Eopathy Europe, and they are organized in Finland as well. So contact them and see if they can assist you in this kind of cooperation. Otherwise, well, call us and we will help you. I know that I'm a bit disappointed that you say there's no one in high authority listens, because when Sweden has had the presidency of EU, things really develop in Sweden, and I thought that would be the case even in Finland. So please type here your question about how we can go on, we can help you. I know that. So if you send me your email, I will contact you about this issue. That was Katie.
Great,
and
thanks.
Then, yes.
Yeah, and then we have Cynthia that is writing that the report addressed getting help for patients without family who are also affected by brain injuries and who need help to interact with and deal with the insurance companies. I wouldn't say that the report really addressed this, but Eskil Digcell, who has been working in the group, this is a question that is very, very close to his heart. Since he is part of the Swedish Brain Tumor Association, and he works with a lot of these questions on many different levels. But do you have anything in specific, Margareta, that you would like to add?
I think it's also depending on where you come from, how you can help. I would not know who would need to help to interact with and deal with insurance companies. This depends on where you come from, and I know that we have addressed it, but I don't know if it's really detailed. But Eskil Digcell, we can contact you with him, and
yeah.
he may have replies for you. Yeah, and in this the QR code, you will have, I think, our email addresses and the website for SAMCA as well. And you're very, very welcome to contact us in any kind of this matter. We are really passionate about co-creation for patients and medical team and researchers in healthcare. So if you have no more questions, we'll just say thank you for your listening to us, and I hope that that you have become a bit more interested in how to work out co-creation.